Salud Services is known for providing outreach services to the vineyard workers and their families. And early in the year, you're planning your entire schedule for the year, and we had this beautiful schedule, and then boom, here comes COVID, and things came to a halt. Things were changing so fast from one day to the next, to the next, to the next. So it was just a big unknown. And then, of course, then you start thinking, oh my God, then you start hearing how this COVID was hitting, minorities, and then you start thinking about, okay, now these illnesses, it will really be hard on people to have comorbidities. So you start thinking about your patients that have diabetes, or your patients that have immunocompromised. Came to a point where we just said we can't just sit still. We have to go out and do something about it. With the help of our infection control specialist and our medical director and others in administration, and created a schedule to go out and offer, besides the standard and regular health screenings, we also concentrating in COVID education, assessment, testing, and follow-up care.
One of the main things that is really important for us to bring Salud mobile unit to the workers is because we are going to be there at work where they are actually working. Every patient is going to rotate. We have a registration, we have a vital signs, then we have COVID station, and then screening, and the patient is going to decide, oh, okay, I'm going to do this, I'm not going to do that.
During my first COVID clinic, I felt emotional in a happy place because I was just so grateful to be out in the community back again. I know there was a lot of uncertainty if we were able to go out in the community, and that saddened me because that's why I joined this team in this role, is because I want to be directly where our patients are. It was an emotional day just to be able to serve our patients and to be there for them. A lot of gratitude behind that first clinic and all clinics coming forward.
All those relationships that we have built throughout the year, that trust has been so important to get the community to come in. And when I say community, I'm talking about the Latinos that are working hard out in the fields. Them knowing, hey, Salud is coming today. I don't have to leave work. I don't have a way to leave work, but they're bringing the service to my work. And so we want to stay safe, we want them to stay safe, and we want their families to stay safe, thus making the community safe. We're all here, we're all together, and we're doing everything we can to, get through this pandemic. Without Salud, this situation would be devastating. If those connections, if that trust was not there from the get-go and this program would have ended, then it would have been fatal.
Just like us in healthcare, our work does not stop. Well, it's the same thing in agriculture. These are essential workers. We cannot ignore their healthcare issues, and now we know now that this illness is hitting really hard this population. And so we have to continue to do everything in our power to provide outreach services, to provide testing for COVID, to provide education to support them, their families, and their communities. We cannot ignore that.